Hello and welcome. In this presentation, we're going to spend some time emphasizing the documentation of the care plan, because it is the documentation that establishes the relationship between the goals of therapy and the interventions to achieve these goals. To be able to fill out a form as efficiently as the one presented on this slide, one needs to go through the learning process of care planning. Care planning involves documentation of such forms for each patient and each indication by identifying the goals of therapy and the drug therapy problems. A pharmacotherapy plan also needs to be developed in order to achieve these goals and treat drug therapy problems and prevent future problems from happening. It is useful to begin by reminding ourselves of where the care planning process fits within the overall patient care process. Care plans are an essential component of the pharmaceutical care process. Care plans are just what these two words mean. They are plans, explicit, clear, and written to make certain that your patient receives the most effective care that is available. Care plans are developed using the information you gather during the assessment process. The success or failure of your care plan is determined at the follow-up evaluation of patient outcomes. Care plans are necessary in order to ensure that all of the patient's drug therapy problems are resolved and that the patient is able to achieve his or her goals of therapy. And we constantly try to prevent new problems from developing. The care plan is very visible to patients and other practitioners alike. The primary purpose of every care plan is to help manage and organize all of the work that you, your patient, and other practitioners will conduct in order to help your patient achieve the goals of therapy. By the way, that's the management part of the term medication therapy management. The work that is managed within your care plan involves you and your patient's interventions designed to resolve drug therapy problems, optimize your patient's medication experience, achieve the goals of therapy, and prevent new problems from arising. In practice, we organize care plans by the patient's indications for drug therapy. That is, if your patient has 3 medical conditions requiring drug therapy, then you will need to construct 3 different individual care plans for that patient. For example, if your patient requires oral drug therapy to manage diabetes and calcium and vitamin D supplements to prevent osteoporosis, and also requires antibiotics to treat an acute bronchitis, then you will need to prepare 3 different care plans for that patient. Each will have different goals, different interventions, and different timeframes. The beginning of every care plan is to set the goals of therapy. Goals of therapy describe what positive results you want for your patient. You must know what goal you want to achieve before you begin to do anything for the patient. Goals of therapy must be individualized for each patient and his or her personal needs. Goals of therapy serve a key purpose within our healthcare system. In fact, it is goals of therapy that allows multidisciplinary care to be provided for your patient. For a team to work together to benefit an individual patient, every member of the team needs to understand what the common goal is. The team depends on you for the goals associated with drug therapy. Goals of therapy serve this important organizing function for patients requiring drug therapy. Care plans also contain interventions to meet the goals of therapy. Interventions describe what you are going to do or what actions you will take on behalf of your patient. Each intervention must be individualized and personalized for your patient. And finally, every care plan contains a schedule for when you will need to meet to follow up with your patient in order to determine the effectiveness and safety of your care plan. To summarize, care plans are organized by indication. They include goals of therapy and described interventions, or what actions you will take specifically to help this patient, and the final component of every care plan is the schedule for the next visit in order to evaluate the progress.